In this presentation, we will be covering information on genetic cancer screening, how this technology can save lives, and the lucrative income opportunity for advocates who are willing to share this information with others, especially those who have been touched in some way by cancer, either themselves or through a family member. Genetic cancer screening tests are covered under Medicare Part B. We like to point out, though, that American Family Financial Association, LLC, or Affa, is not an employee of or have a contract with Medicare. We are Affa advocates helping to educate the public regarding genetic cancer testing because we believe these tests can help save lives. Next-generation sequencing laboratory tests can help doctors take advantage of cutting-edge technologies to make personalized medicine a reality for many cancer patients. About 5 to 10% of all cancers are thought to be related to gene mutations that are inherited or passed down through the family. Having an inherited genetic mutation does not mean a person will get cancer. It means that they are at a higher risk for developing a certain type or types of cancer. A type of testing called predictive genetic testing is usually recommended when certain types of cancer runs in a family and a gene mutation is suspected. So what is predictive testing? Well, it is a test that can help predict the likelihood that an individual will develop cancer in his or her lifetime. But not everyone with a cancer-related gene will develop cancer. Scientists can use the information we gather from these tests to help stop the cancer mutation in families. So prevention is the key. The PREVENT test is a comprehensive cancer risk assessment test designed to determine a person's risk of developing up to 8 cancer types. Armed with this critical genetic information as well as other medical and family facts, your clients can create a strategy to reduce their risk of developing one or more of these prevalent cancers. So clients should consider this type of testing if they have several first-degree relatives like their mother, father, sisters, or brothers with cancer, or if any relatives on one side of their family have had the same type of cancer, or if a cluster of cancers in their family are known to be linked to a single gene mutation such as breasts, ovarian, colorectal, and pancreatic cancers. A family member has more than one type of cancer, or if family members have had cancer at a younger age than normal for that type of cancer, or if close relatives have cancers that are linked to hereditary cancer syndromes, or if a family member has a rare cancer such as breast cancer in a man, or retinoblastoma, which is a type of eye cancer. Ethnicity does play a role. For example, Ashkenazi Jewish ancestry is linked to ovarian and breast cancers. It is reported that 1 in 40 Ashkenazi Jewish women has a BRCA gene mutation, which is the most widely known genetic fact that can lead to breast cancer. Or if a physical finding is linked to an inherited cancer, such as having many colon polyps, or if one or more family members have already had genetic testing that found a mutation. In these cases and many others, people should get the genetic cancer screening test done. Whether inherited or not, cancer is a genetic disease, and decoding its DNA can help the scientists and doctors better diagnose, treat, and manage it. So what are your first steps when you meet with a client for testing? The first thing you want to do is to check their health plan to see if we accept it. A link is provided that will take you directly to Medicare.gov where you can easily check their insurance plan. Then you want to complete the scope of appointment, or the SOA. However, if you are doing a public meeting that was preset and everyone knows why they're there, the SOA can be completed after the group meeting and when you meet with the client personally. Then you will complete the questionnaire form with the client to find out if the client pre-qualifies enough to move to the next step. You will then connect to an advisor through your iPad that in some cases Affa will provide. The advisor will get the documents completed and connect you to the telemedicine doctor for final screening. If approved, the telemedicine doctor will walk you through doing the cheek swab test and packaging the sample to send to the lab. So who pays for these tests? Well, Medicare insurance will pay for the genetic screening test. And what Medicare plans qualify? Well, as of now, Medicare only will qualify, as well as Aetna Medicare PPO, United Healthcare PPO, AARP, HMO and PPO, Cigna Medicare PPO, and Care Improvement Plus. New plans will be continually added. We also encourage our clients to refer other family members and friends. However, the person that's being referred must call the Affa advocates for an appointment, even if it's a family member being referred, because we advocates cannot make the first contact with Medicare clients. So let's do an overview of what we just discussed. Once Affa receives your scope of appointments, you will receive your test kits and, in some cases, a medical iPad. Once you get your iPad, you will start a chat with the advisor. And that advisor will complete the questionnaire form with the client. The client will then be instructed when and how to e-sign. And the advisor will connect the client to the telemedicine doctor. The doctor will check the client's eligibility again. And the doctor will prompt you when and how to do the cheek swab. So now that we know the steps to meet with the client, explain the genetic testing, and get their DNA and send it to the lab, now what? Well, let's talk about how you can be compensated for your efforts. For each client you personally get approved and whose DNA is sent to the lab for analysis, Affa would pay the advocate, you, for personal history of cancer, $700. Or for a family history of cancer, which would be a referral, Affa would pay the advocate, you, $350. Just one approved swab a week for a personal client and one for a referral client could yield you $1,050 a week. Well, think about if you did 1 or 2 approved swabs a day. That could certainly change your financial future. We're going to look at building a team and receiving overrides. For each person that's added to your team on your 1st through 3rd levels, you will receive a 10% override. For each person that's added to your team on your 4th through 6th levels, you'll receive a 5% override. On your 7th and 8th levels, you will receive a 2% override. And on your 9th level, you will receive a 1% override. Now, building a team is optional. You do not have to build a team in order to make money. However, why not earn extra money in addition to the commission you personally generate? So let's talk about team building. What if you enroll 3 advocates and each advocate enrolls 3? Now remember, overrides are paid down to 9 levels, and each advocate will do only 1 test that's approved per month. If we look at the first 3 levels, you'll see that you will have the opportunity to have an override of around $2,700 per month, just with 3 people bringing in 3 and so on. If we add another 2 levels down to your 5th level, that gives you the option of having over $14,000 per month in overrides just on 5 levels. And we've got 4 more levels that we didn't even count yet. But what if you enrolled 10 advocates and each did the same? And again, only 1 test approved per month. How would that look? With 10 people bringing in 10 down 3 levels, that gives you the possibility of earning $77,000 a month just in overrides. Let's look now to the 5th level. Now you've got over 100,000 people on your team. The income potential is around $3,927,000 a month. Well, we know that this is not a perfect example, but it does give you an insight on how serious this income potential is. And here's our earnings and income disclaimer. Earnings and income statements made by Affa and its distributors are estimates of what you could possibly earn. There is no guarantee that you will make these levels of income, and you accept the risk that the earnings and income statements differ by individuals. As with any business, your results may vary and will be based on your individual capacity, business experience, expertise, and level of desire. There are no guarantees concerning the level of success you may experience. So, with that being said, how do you get started? The total cost to get started is $65. That includes $50 for the administrative fee and $15 for the HIPAA certification. To get signed up, you just go to the website of the person who introduced you to this opportunity and pay the 2 fees online. You'll complete the online application, complete and pass the HIPAA quiz, complete the advocate's agreement, the W-9, the direct deposit forms, and you'll email or fax those forms to corporate. So we'd like to be the first to welcome you to American Family Financial Association. We are an organization of advocates who are dedicated to helping Americans receive genetic cancer screening tests.